what is happening to the retina in a patient and to the cardiovascular system at large in a patient with compromised metabolic health?
Well, so I always tell patients, your ophthalmologist may be the first person to identify hypertension or high blood sugar because of the microvasculature that infiltrates and feeds the retina. So you've got these tiny little blood vessels that are really at the will of be it high blood pressure with the shear forces, high blood sugar being affected by the hyperinsulinemia, the advanced glycation end products, the high amounts of reactive oxygen species. So they're really being highly damaged and they're just so fine. And the endothelial lining, which you know I'm big on, the endothelial lining, again, just one cell layer thick, they're being so damaged. And it's really hard for them to regenerate in this inflamed environment. So they're being damaged from the inside and they're not properly responding to the adequate hemodynamics. They're not expanding and dilating, feeding the retina, feeding that optic nerve. So we see that there's a shrinking in the vessels, a dysfunction in those vessels. And so the retina is not receiving adequate blood flow, adequate nutrient levels. So that's just from go. So we know that there's problem with those teeny tiny little blood vessels. As that progresses over the years, then it gets worse and worse with the blood vessels as well. Then say we come in with something like a GLP-1 agonist and we say, all right, we're putting up a halt. We're slamming the brakes on the elevated insulin, slamming the brakes on the elevated blood sugar, and we're just tanking that, which is good. We have significant cardiovascular benefits, significant benefits on, I mean, we could go on and on. The inflammation in the system, the neuroinflammation. So we know that bringing those numbers down is beneficial across the board to the entire system. But what happens to the blood vessels and to the surrounding nerves? They suddenly are kind of starved because they're used to being constantly bathed in sugar and insulin. And so you're changing the environment so that they kind of go into a shock. So they kind of shrink up. So this ischemic changes are really not surprising at all. Granted, this was not at a very high rate. So again, I think 8.9% was the ultimate findings of these diabetic patients.
Yeah, the numbers we'll get into that. I want to back up a little bit though. I don't mean to interrupt your thought process. I just want to back up. I want to make sure that everybody understands this in like normal people terms. So first off, what is the endothelial lining? Describe that.
So the endothelial lining is just the innermost wall of the inside of a blood vessel. So it's what interplays with the blood flow. So it's very sensitive and it's got all of these nice fibers and sugars or proteins and sugars that interact with the blood and produce nitric oxide, which is allowing the blood vessel to expand, bringing the blood pressure down, or constrict, bringing the blood pressure up, depending on what's appropriate. So that inside wall of the blood vessel is what's often compromised and kind of at the core of coronary artery disease, peripheral artery disease. So we have to really be concerned about that endothelial lining. It's kind of our barrier system for the vascular system.
And it's very reactive in real time. It's very sensitive to what's happening. And like you said, it interplays with how the vessel behaves, whether it dilates or constricts. Now, secondarily, I'll add, when you have hyperglycemia or elevated blood sugars for an extended period of time, then you're also going to get thickening of the vascular walls. Not that you're not just going to get disruption of the endothelial layer, but the actual additional lining walls of vessels get thickened and fibrotic. So they're not as responsive either. So that's okay. Step one, I want people to understand this. And then the second part is, let's go back to the retina. You were talking about microvasculature. Explain what that is. Like, explain the artery into the arterioles, into the capillaries, into the microvasculature. I can't talk today.
Yeah. So the big
microvasculature.
So the big picture of the arterial system. So you have your heart, and then out of that, the arteries are what brings blood away from the heart to deliver nutrients and oxygen. Starts with the aorta and then it branches off and then it goes into smaller branches and then the arterioles. And then in these fine capillary beds is kind of that end space where it says, all right, are we delivering? And then it turns into the pickup to take back to the heart. So it gets very, very fine, and it's literally one red blood cell at a time making its way through.
Yes.
So that is a direct interplay of what's going on in the bloodstream and how that's interacting with the endothelium.
Okay. So in the type 2 diabetic, or in someone who's had extensively high blood sugars for a long period of time, that entire system that you just described loses its elasticity. It gets more fibrotic, like I just said, and that endothelial lining, that beautiful dance of what you call the glycocalyx and all of that jazz in there, gets really fouled up because of this chronic, long-standing high blood sugars leading to high inflammation. Is that the gist of it? I mean, would you say that explains it decently?
And
what do you want to add to that?
Well, when I talk to patients about, so if we can kind of look at the hemoglobin A1C, HbA1c is something that will come up when we're talking more about this study. But if we think about the red blood cell, the hemoglobin A1c is an assessment of how sugar-coated is that red blood cell. So I tell patients, okay, if we're thinking about your red blood cell is like a Cheerio, for example, is it a sugar-coated frosted Cheerio? You can imagine that rolling through that teeny tiny little hallway. That's going to cause more damage, more nicks, more irritation than a not sugar-coated Cheerio. So I think that that's a good way to kind of picture it too.
Okay, yeah. These sugars dance together. They communicate together. So a sugared up red blood cell, i.e. one, patient with an elevated hemoglobin A1c, is going to be a much less smooth and elegant flow. And then additionally, again, the vessels themselves have lost elasticity. I mean, quite literally, when you look at what diabetes does to just your fibroblasts and your elastins in all of your cells, it makes everything fibrotic and tight. And interestingly, GLP-1s reverse that and change that entire picture and improves elasticity across the board in the body. That's one of the reasons why folks on GLP-1s say, I'm moving better, I feel better. It's because it's actually returning this elasticity to our tissue. So just not to digress.